Jai Jinendra.
Jai Jinendra.
Jai Jinendra Sheetal.
Samniji just called me and we're going to do the meditation in the beginning, she said. So
Okay.
she's going to join us in a little bit.
Okay.
So if you want to start, we can start it. Okay, it's already 8. So
1 more minute, maybe.
okay. Where is everybody? Today we are not seeing anyone. I thought that Friday is tomorrow, but it's look like that means we have Friday today itself.
Should I start?
Yes. Let's start.
Few people are joining. Jai Jinendra, everybody. Today we are going to start off the class with meditation first, and then Samriji will join in about 15 minutes. So we will start off the class with stretching yourself. Let's get up and stand on our toes. And give me 1 second here. Okay, let's go ahead and do Tadasana. Do that 3 times. Interlock your hands and take them up and stretch. There we go. So let's sit in a comfortable posture, keeping your back, your neck, and your head straight. Close your eyes gently. Inhale deeply and exhale slowly. We will start the meditation with the recitation of Om Mantra 5 times. Om. 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 I am practicing Preksha meditation for the purification of my soul. I am practicing Preksha meditation for the purification of my soul. I am practicing Preksha meditation for the purification of my soul. The first step of meditation, Kayotsarg, full body relaxation. Keep your body stable and steady, no movement at all. Suggest your body to relax, relax, relax. Bring your attention to the big toe of your right foot and suggest to relax. Suggest the other toes to relax, the sole, the heel, the calf muscles, the right knee, the thigh, and the hip. Feel the right leg completely relaxed. Now bring your attention to the left toe of your foot and suggest to relax, relax, relax. Relax the sole, the left heel, the left calf muscles, the left knee, the thigh, and the hip joint. The lower part of your body is completely relaxed. Now bring your attention to the center of your body, your abdomen, the intestines, the stomach, the heart, your lungs, the lower back, the mid back, and your shoulders. Feel the entire center portion of your body being relaxed. Relax your right hand, the right elbow, and the upper arm. Feel the relaxation on your left hand, the elbow, and the upper arm. Now relax your neck, your face, the eyes, the nose, and your entire head. Experience your whole body has relaxed, relaxed, relaxed. Now bring your attention to Vishuddhi Kendra, situated in the center of your throat. Perceive bright blue color around you. Experience the bright blue color particles surrounding your body and all around you. Inhale the blue color. Experience with each breath the bright blue color particles are entering inside the body. Experience the bright blue color particles are emanating from the Vishuddhi Kendra, which is the center of your throat, and spreading all around the body. Your aura is filling with the bright blue color particles. Experience your biochemical urges are pacifying. Experience the blue color particles are spreading all around your body and pacifying your urges. Inhale deeply. Exhale slowly. Now, with 2 long breaths, we will conclude our meditation. Inhale deeply. And exhale completely. Rub the palms of your hand and place it on your eyes gently. Om Arham.
Thank you, Sheetal-ben.
Thank you. It was wonderful.
Thank you. Very nice.
Thank you.
Very soothing voice.
Thank you,
That's great.
Sheetal-ben.
You're welcome.
Thank you, Sheetal-ben.
Can everybody see the color? Damina and Sami.
Hello everyone.
Namaste, Samji.
Yes. So meditation is completed.
Yes.
Yes, we just finished it, Vandami. Just finished it.
So thank you very much. So today's topic is how yoga, meditation, and mudras, etc., can help us to overcome the problem of diabetes. So we would try to know and learn about that. Okay, so okay. So who is Suryan? Why there is a voice in background? So today we are going to discuss about Preksha therapy for diabetes management, and we will see that how asana, pranayam, mudra, mantra, and lifestyle all can contribute or help to overcome the problem of diabetes. So there are evidence supported physical exercises which we can practice every day to control our diabetic problem. So the first is Ardha Matsyendrasana. So this is a exercise which is done especially to affect the spinal twist. It gives the spinal twist, and it improves pancreatic perfusion, stimulates abdominal organs, and there are certain researches, though Dr. Devendra has already what we say informed or discussed about what kind of researches are going on these yogic practices. So we will see that there are small RCTs show improved post-prandial glucose. So this kind of a study has already been done on it, especially on this particular posture. The second physical posture, we can say Vajrasana. It is a Thunderbolt Pose, or you can say diamond posture. It enhances gastric emptying, improves insulin response, and it is shown to reduce post-meal glucose spikes. Dhanurasana is another physical exercise which can help us to control the diabetic problem. It is a bow pose. It stretches pancreas region and improves autonomic tone. And associated with improved fasting glucose. So it is said that if we can do fasting with it, with this particular exercise, it means that whenever we are doing exercise, if it is done in the fasting, during the fasting, then it can help us to control the diabetes. Then next is Surya Namaskar, the sun salutation. So all these exercises you have learned very well from Anuja and from Ramesh Verma. So just we can see that Surya Namaskar asana or exercise, it increases metabolic rate, improves muscles, glucose uptake, and moderate intensity aerobic equivalent. So it is equivalent to that. So just we can see how we can practice all these physical exercise at regular basis, especially those people who are having such a sugar problem or pre-diabetic. They should start practicing all these physical exercise. There is a pranayam, so under the recommended yoga practices for diabetes, and it is medical point of view is also very important for us. So evidence supported pranayam. So which pranayam we can practice? So the first is Anulom Vilom pranayam, second is Bhastrika, and the third is Kapalabhati. So Anulom Vilom pranayam, it balances autonomic nervous system, and there are some evidences that how it works. So HRV improvements in diabetes, and this proves that this pranayam is very helpful in controlling our diabetic problem. Bhastrika, it enhances oxygenation, boosts metabolism, which improves insulin sensitivity. And Kapalabhati, this is also very important. What we say, breathing exercise. It stimulates abdominal organs, reduces waist circumferences, and it is shown to reduce fasting glucose. So in this way, these pranayam which we have already practiced a lot, and we are very much familiar with all this physical breathing exercise. If these exercise can be done at regular basis, then our sugar can be under our control. Next is there are certain clinical safety guidelines for following all these or practicing all these physical exercise and breathing exercise. So avoid pauses causing abdominal compression in patients with neuropathy. So we have to be careful about it. Monitor for dizziness during pranayama. If there is a dizziness, then we have to avoid pranayama. Avoid Kapalabhati and Bhastrika in uncontrolled hypertension. So in that state, we should not practice all this exercise. Encourage slow progression for sedentary individuals. So in this way, these are the precautions we have to be careful of before we start anything. If our physical condition is not according to the physics in these exercises. Now, yogic physiology, scientific framing. So, what are the particular Sanskrit terms with medical parallels which we find? Here, the pran, autonomic regulation or oxygenation in so pran is recognized in this way, in this form, in the medical science. Nadis, they are neural pathways, and chakras, neuroendocrine plexus. So these are the particular terms which are especially important to understand when we are practicing any yoga for any physiology, health issues. And these particular yogic terms, they are recognized in medical field in these particular terms. Chakras are important. So chakras are endocrine mapping, clinically neutral language. So endocrine mapping is recognized in the sense of chakras in medical field. So chakra are very much connected with endocrine glands, and which we have discussed at length when there was a lecture on chakras or perception of psychic centers, especially when we were discussing about the scientific aspect of this particular meditation technique. Then we have discussed that how chakras are closely connected with different endocrine glands. So here we can say especially three chakras are very important to control the diabetic problems. And the first is Vishuddhi chakra. It is thyroid metabolic rate regulation. So it controls the metabolic rate or balances it. So if we can concentrate on in the center of the throat, which is the place of the thyroid, and it is known as Vishuddhi chakra or Vishuddhi Kendra in Praksha meditation. So if we concentrate or meditate on that particular center, then we can control the metabolic rate, which is very important for controlling the diabetes in the blood, sugar in the blood. Next is Anahat. Anahat is the center which is known as Ananda Kendra in Praksha meditation system and Anahat chakra in the Hindu yoga tradition. And the place of the Anahat chakra is the place of the thymus gland, which is behind the heart. So here you can say it is very important gland for us. Immune modulation type 1 DM relevance. So this is important from type 1 I think diabetes patients or diabetic management. So we can just concentrate on the heart and we can activate that particular kendra or center and thereby the thymus gland to immune modulation. Now next is Manipur. So this is the center, or you can say chakra, which is located at our navel, and it is very important. You can see this is very close to the pancreas. Metabolism, insulin secretion, these can be controlled by meditating, especially on Manipur chakra. So these meditations are also very important, you can see from diabetic angle. Now we would see that Vishuddhi Chakra and metabolic health, how they are connected with each other. So they are located at cervical plexus and influences thyroid. Uh, Second is thyroid hormones regulate basal metabolic rate. Third is yogic practices like the Ujjayi Pranayama or chanting of the mantras stimulate vagal pathways, and this Vishuddhi Chakra meditation improved vagal tone and later glycemic control. So I think Dr. Devendra would clear all these things more. We would understand how these points are important for us to understand from yogic point of view. Now we would see that breath work and autonomic modulation. So it is said that slow breathing, parasympathetic activity. So if we have slow breathing, it means that there is a parasympathetic nervous system is active. So that will also help us to control our diabetes. And parasympathetic dominance, cortisol, glucose. So these, if parasympathetic nervous system dominates, then these cortisol and glucose can be maybe more into our blood. HRV studies confirm improved autonomic balance. So here we can see that how these breath work and autonomic modulation uh, can also help us. So especially when we are taking slow breathing, that breathing can help us to control our autonomic system and thereby the diabetic problem. Now we see that we have to change, we have to adopt some ethical values which are also very important to control our diabetic problem. For example, if we have self-restraint or self-discipline, so it supports adherence to diet, meditation and lifestyle. So we can, if until we have self-discipline, we cannot control our diet. Whatever we are eating, sometimes it is causing the diabetes. But since we are fond of such certain type of things in our diet, and that's why we are continue with that diet and think that we have our sugar should be under control. So it is very difficult. Even we are taking medicine, instead of that, we may have some such problems. So somewhere we have to control our diet, somewhere we need some medication to control our stress level. And also there are certain things which we have to change in our lifestyle which are causing sometimes diabetic problem. For example, if we are sitting for longer period or standing or not doing any physical exercise, then also we may have such kind of problem. Next is behavioral medicine recognizes discipline as a predictor of glycemic control. So you can see that behavioral medicine also prescribes that our lifestyle should be completely disciplined, and if we are living that kind of a lifestyle, then automatically we can control the glycemic what we say problem. Now there are certain values, for example, non-violence. So if we practice non-violence in our day-to-day life, not just as a religion, that is good. But if somebody is having some problem of diabetes, then he or she has also to think about the non-violent lifestyle. So if we are following non-violence, then it helps to reduce emotional reactivity. Mostly whatever happens something with us which is not good for us or not in our favor, we become at once reactive, and that reactivity increases the stress level in us and thereby all these different health issues. So lower stress, lower cortisol, improved glucose regulation. So these are the connectivity, how lower stress can control our cortisol level and thereby can control our glucose in the blood. Aparigraha, that is non-possessiveness, reduces emotional eating and compulsive food behaviors. So it is necessary that we have to be non-possessive. If we are greedy enough and we have so many desires and material cravings, we are always after them and not taking even the rest at time. We are not eating at time, and that sometimes causes this diabetic problem. So reduces emotional eating and compulsive food behaviors. We have to eat with peaceful mind, and we have to take the proper diet. Aligns with cognitive behavior therapy principles. So this aparigraha principle also is referred or prescribed in the cognitive behavioral therapy uh, to control our these kind of health issues. Now, mindfulness. So now mindfulness is very important to reduce the stress in our day-to-day life. So, and for that we have to be very much aware of our breathing process, how we can be what we say focused on our breath in spite of doing so many things from morning to night. If our mind is engaged in breathing perception, then we would not have that much stress because of the work which is generally found in the common human being when they are engaged in some activities. Thought observation, it is also very important. There is one of the main techniques of lecture meditation, and that is thought observation or perception of thought. So we have so many thoughts in our mind, and because of that our mind sometimes become so much tensed or stressful, and that helps to increase all these different health issues in our body. So how we can be more focused on our thought process also, what kind of thoughts are going and coming. Just we have to observe them without interrupting them, without stopping them, or without making any judgment or liking or disliking. So if we can start observing thoughts in a neutral way, we would see that the thoughts are reducing, and there would be only the necessary important thoughts in your mind and not unnecessary or tension creating thought waves would not be there. Non-reactivity, it is also very important. So when we become mindful to everything and every emotion and every situation, in that state we would not be so reactive as we become in general. So here mindfulness helps to be more and more non-reactive and more pure observer of every situation or every ups and downs of our life. So we would not have that much stress because of unfavorable situations or critical situation, and we can be also very healthy. All clinical validated in MBSR research, you can see that this kind of evidences are found that how mindfulness can help us to have such kind of mental state or emotional control in us. There is another many other things which we can include in our lifestyle, and they can also help us to come out of this problem of diabetes. So the first is diet. So we know that diet is very important, and it is said that most of the health issues are because of our wrong diet. So if we can understand that what kind of things are suitable for my body and how much nutritious things we need, sometimes there is good thing, but if we are taking out of limit, then that can also create some problem to us. Just I was watching one video, just one small one Ayurvedic video, and the message was given that the banana is very good and it is a complete diet for us. But those people who are not doing physical exercise, they are mostly sitting or living in a very comfortable situation environment. So if they take banana more in the quantity, then it may create diabetes, it may create other health issues. So otherwise the banana is very good for us, for our health, if we are taking once in a day. So diet is very important. It is important for low glycemic, plant forward diet should be there. Non-veg diet or such alcohol or drinks or fast food or junk food, this kind of food should be avoided, so that we would not have such kind of problem. High fiber, improved insulin sensitivity. So in our diet, we have it is prescribed or it is suggested that the food should be with high fiber, and it is said that whatever age we have, suppose I am of 70 or 60, then 600 fiber based food should be, it means 600, it means 600 gram, 600 gram salad or such kind of fiber based items should be taken before taking the lunch, and half of the quantity should be taken in the morning before taking breakfast, and and also before the dinner. So in this way, it is said that the fiber-based diet can help us to improve the insulin sensitivity, and thereby we can control our sugar problem. Jain vegetarian diet aligns with the ADA recommendations. So in this way, we can learn how Jain vegetarian diet can help us to come out of these things. Now, sleep. Poor sleep, cortisol becomes high, and insulin resistance becomes also increases. So here we should be very much clear that sleep is also a kind of medicine for the people who are having diabetes or stress. So they should sleep on time. It is not for them only, but for all people. And it is very famous slogan that early to bed, early to rise. Everybody should go to bed at least by 9 p.m. or at least 10 p.m. According to one study, it is said that 10 to 1 is the right time for taking sound sleep. It gives 2 hour rest in 1 hour to our brain. So it is very good or quick time for the brain to take rest from 10 to 1 a.m. 10 p.m. to 1 a.m. After, if we are sleeping, we are taking rest in 1 hour in 1 hour, from 1 to 4, and from 4 to 7, we are, if we are taking rest, we are taking hard, if we are sleeping for 1 hour, we are taking hardly half an hour rest. So in this way, we can see that as the sun rise comes close, our brain starts working, our whole body system starts working. It is very much connected with the solar system. So if we want to take a rest, proper rest or sound sleep, then the best time for us to go to bed is 10 p.m. to 1 a.m. So if sleep is not proper and if it is poor, then automatically the stress level and also the insulin resistance increase, and that causes the problem of diabetes. Yoga Nidra improves sleep quality. So Yoga Nidra means when you are sleeping, you have to be very much you have to be in a very sound sleep without any dreams or any other thoughts. And also there should be completely inner awareness that you are in a sound sleep without any such kind of mental disturbance. Stress management, so meditation reduces CRP, IL-6 and cortisol. Yoga improves HRV and vagal tone. So stress management is also very important for us, and how we can be benefited by it. So we have seen these two main what reasons. Next is physical activity. So Surya Namaskar, it is a moderate aerobic activity, like, and if we are practicing this particular exercise in which we follow almost 12 steps, and all those 12 steps give exercise to each and every point, each and every part of our body, and it is a kind of a complete set of exercise. So there is a 12 in one, and it is very important in Hatha Yoga tradition. The yogis especially, they practice this Surya Namaskar at least for 108 times, though they'll start from 1, 2, 3 and go on increasing up to 108. So they control their body to such an extent where they can stay even in the ice, in the very cool environment like the Mount Everest, but without any clothing, without any protection. So this kind of physical strength can be developed by this particular exercise if we are doing at regular basis and in a proper number. It physical improves glucose uptake via GLUT4 activation. So if we are doing physical activities, then it improves our glucose uptake, and mostly since nowadays we are getting all the facilities without doing anything, everything is ready for us, and now this is the age of robots, that a human should not do anything, just everything can be done by the robots. So if in such kind of a lifestyle, if we adopt, automatically there would be many health issues with, rather than we can have very good health with all this comfortable zone, or all these what we say instrumental help which we are getting, or the facilities which we are getting. If we are using more and more them, then our health automatically will be affected, because we are not giving any good exercise, or we are not being involved in physical activity, and because of that we are getting such sugar uptake in our blood. So lastly, I would say that we have to integrate all these points: physical exercise, breathing exercise. There is also mudras, and we have learned Surya Mudra. So this Surya Mudra helps to control the sugar. So this Surya, in this way, these yogic practices we have to involve every day in our day-to-day life. Maybe some people have not yet any such kind of problem. Instead of that, they should also start practicing all this, because automatically we are finding that we have cut so many physical activity from our day-to-day life, and we are becoming more and more dependent on the machines or auto systems. So in that condition, if we don't practice all these things, then it is very hard to be to prevent these kind of health issues. So it is necessary, and that we have to integrate all these things in our day-to-day life, and we have to do some meditation or make some routine for that. So 5-minute warm-up, 10 minutes physical exercise, 5 minutes breathing exercise, 5 minutes meditation, total 25 minutes we have to spend, especially for our yoga practices to live a very healthy, happy life and very disciplined life. So with this, I would like to say that how yoga can help us to control our diabetes, and all these yogic practices are really very effective and very important to control our sugar problem. So with this, I would like to conclude my talk of today, how yoga, meditation, pranayama, and physical exercise and mudras. And there are certain mantras too. But in comparison to mantras, these physical exercise or breathing exercise or mudras are more effective. We have to focus on them and make them the part of our lifestyle or routine. So thank you very much. If somebody has any questions, let me know.
Vandami, the last slide you put where we have the diet, the sleep, stress management, there are
Correct.
certain things that number 3, stress management. Meditation reduces CRP. What does that stand for, the CRP?
Okay, so Dr. Devendra, can you explain what is CRP? Actually, I could not see the full form.
It's about the HRV, that's the heart rate variability. HRV, is that the question?
Oh, okay. Yeah,
HRV
yoga.
is a heart rate variability.
Okay, heart rate variability. And
Because
the
that tells you your autonomic, it tells you your balance of your autonomic system, your sympathetic, parasympathetic is one way to measure that.
Oh, okay, got it. Then it says meditation reduces CRP.
Oh, CRP is a C-reactive protein. That's a inflammatory marker. So it's like a measure of how inflamed your body is. There are two markers like that. CRP is the one we often use. So when you're chronically ill, your CRP goes up.
Okay.
And so when it's down, your body's less stressed. It's not cortisol stress, different. It's inflammatory stress. Cortisol is your hormonal stress. This is your inflammatory system marker of stress,
Okay.
your immune system.
Okay. One slide which was not explained, but I think Dr. Devendra can help to explain that slide especially.
Yeah, show that again, Samija. I can do that. Sure.
I would like to share that one. Just let me. Okay, so this one, Vishuddhi Chakra and metabolic health.
Yeah, so I think the way to think about it is that when you focus on your thyroid gland, your thyroid hormone is the hormone that tells your or each cell how much energy to burn, how awake to be. It sets. If it's too much, then you burn fuel and get sick. Too little, then you're very sleepy. So the thyroid hormone regulates that. So if you focus on your thyroid, then that regulation is better. And again, Ujjayi can help that. And then we know already from the slides we've seen many times that when you do your chanting, Ujjayi, in fact, many of this, they stimulate your vagal pathways. The vagal tone is the same one that we looked before. It goes to your heart, the lungs, also goes to your pancreas. And so the vagal tone will affect your how much insulin and its opposite glucagon you make to control your sugar. So there are two different methods. The thyroid one is just your burn rate. So if my burn rate is calm, then that'll help your sugar control, because you're not too low and you're burning enough sugar, so you're not accumulating sugar. And then the vagal nerve is the nerve system that supplies tone to your pancreas. So then if that's more efficient, then your pancreas tone will be better. So both ways. And at the bottom, we already know the Idam Pingla, right? That when you have slow breathing, you deep breathing, you get your parasympathetic up. If that is up, then your sympathetic is down. So if parasympathetic is up, then your cortisol is down. Because sympathetic is running and energy. That's when it uses cortisol to give you fuel. But parasympathetic is relaxing. So your cortisol is down and your glucose is down. So you're mobilizing less glucose. So when your cortisol is up, it'll mobilize more glucose from stores to make it free so that our body can use it for our stress, whatever that cortisol is trying to respond to. Whereas if your parasympathetic is the opposite, your cortisol is down, and so therefore will be less glucose, free glucose available. And the heart rate variability studies, as we talked about, confirm your balance. So if your variability is normal, then you've got good balance between the systems. So it's one way to test that balance. Does that help?
Yes. Here, slow breathing increases the parasympathetic activity.
Correct.
And parasympathetic dominance reduces cortisol and glucose.
Correct.
So what is the difference between this parasympathetic activity and parasympathetic dominance?
All that means is that the ratio of parasympathetic to sympathetic is higher. So it just tells you that your parasympathetic is higher than your sympathetic. Dominance means that I'm like after a meal, or when you're sleeping, your parasympathetic is high and your sympathetic is really not very high at all. So it's dominant. Whereas daytime, when you're walking, talking, studying, focusing on things, and engaging your brain, your system, then your sympathetic is dominant.
Mm-hmm.
So it's same. Eden Pingla says which at some point the Pingla is dominant, the sympathetic, at some the Ida is dominant. So parasympathetic dominance means that the Ida is dominant. Whereas in some situations we want to balance. So balance is that both are equal. So depending on what you're doing, you need all those options.
Okay, so slow breathing and parasympathetic activity. So this is good that if we are breathing slow, then it is helping to activate the parasympathetic system.
Yeah, Pingla,
yeah. Okay, it is a Ida.
Ida is parasympathetic and Pingla is sympathetic, correct?
Yeah, Pingla is sympathetic.
Correct.
Correct.
Right side and Ida is sympathetic.
Right side is Pingla.
It is cervical plexus, no?
Yeah, cervical plexus is the nerve complex in your neck behind the thymus. It's right on top of your spine, cervical spine. So that's close to thyroid. So when you're doing Visuddhi Chakra, you're probably affecting both.
Okay. So this is clear. Just so what is glycemic, low glycemic?
So when you eat any food that has starch in it or glycogen or starch, like any vegetable or any dessert like cake or a biscuit, then how much of that is free, that is how much you'll get free sugar from that, as opposed to how much is bound in with fibers. So if the food has a lot of fiber in it, the same amount of sugar will have low glycemic index, because it's a difference between the fiber content and the sugar content. So I can have the same sugar in a vegetable, but it will not affect me. Whereas the sugar, which is pure itself, like in a donut, will then affect my sugar. So glycemic index. So every food that we buy, they will calculate the glycemic index. There's a record of every food you can see of glycemic index. So if you want to stay healthy in the sense of not increasing risk of diabetes, then low glycemic index food are the best. And in general sense, we say with high fiber, but this is actually measured amount, so you know exactly what it is. In a general sense, that's correct. It tells you exactly each food how much is, like how much a grape has, how much a carrot has, how much a banana has. All those are written. And the lower the glycemic index, the better control of your sugar, because you're not going to absorb that sugar too fast when you eat it. So when you eat this food, it goes to your GI tract, and then if it's just purely starch, then it'll very quickly get absorbed because there's nothing to slow it down, and it affects your insulin response. Your pancreas has to work really hard, and the more sugar and the faster you absorb, the higher the insulin level. And so every time you do that, you're hurting your pancreas by making it work really hard. The same sugary meal, if you have with the fiber, like vegetables or other forms of fiber, then the fiber is mixed in with the sugar. So the sugar is only slowly taken up. It slows it down. So now sugar goes slowly in, your pancreas has a nice time to respond. It doesn't have to over-respond. So your pancreas has a quieter, smoother response. So your pancreas doesn't get tired. So if all your life you eat food that is high glycemic, then your pancreas going to tire very quickly. Whereas if it's low glycemic, the pancreas has much more reserve. That's why you want to avoid eating dessert by itself. If you want to have sweet things, have it as part of a meal. But if you have it separately, then you're going to tire your pancreas.
Okay. And what is it, CRP, IL-6?
Yeah, CRP, same, C-reactive protein. So it's a marker of how inflamed your body is. It's usually associated with disease. This is not stress like cortisol. This is more like I am inflamed because I have chronic ailment. If I'm very stressed, it'll also go up. So it's a marker of stress in that sense. IL-6 is an interleukin. So when your body inflammatory systems talk to each other, let's say your white cells talk to each other to help them fight off infection or illness, they use this message. It's interleukins. Inter, which is between, and leukin is white cells. So it's between white cell messaging to say, hey, guy, I need more help, and it attracts more white cells. White cells are the ones that cause a response to inflammation, maybe the damage, but they're your protectors. But if you over-inflame them, they'll also cause damage. So they're your weapons against viruses, cancer, bacteria, and your body is constantly looking out for these, and it'll call them to defend you by IL-6. There are many like IL-6, many interleukins, more than 20, but this is a common one, IL-6. And so that calls the white cells where you need them, and they know where to go and attack and try and defend the body. But when it's high, that means your body is constantly in a fighting mode. And when it's low, it means you're relaxed.
And this is GLUT4?
GLUT4 is a uptake. So in many cells, if you remember, Riddhi showed you a lock and a key, how the cells take glucose in, and you have a lock for the insulin, and the glucose goes in. That glucose goes in by these transporter. So they basically, your cell has these machines, almost like machines on this border. They're like gates, and they pump the sugar in. So if you have enough insulin, it will allow the gate to let the glucose come into the cell. And if you don't, the gate will be sleepy. But if you have insulin, that it'll wake up the gate. And the gate has to be awake to allow glucose to come into the cell. So the cell wall is very much controlled, very well finely controlled. And GLUT4 is a receptor where glucose can sit on, but until the insulin says, let it in, it won't let it in, it'll just hold it or let it leave again. So if you don't take in the cell, it's going to lie in the bloodstream and make you sick. And you get all the problems with nerve damage and muscle damage and the damage of diabetes. But if you take the cell can handle it, and cell will use it fuel or store it. But if it's outside the cell, that's where the damage occurs. So you want the cells to be able to take the glucose in when it's available so that they can mop it up, and the cells can keep it safely. They can convert it to different stores. So that's kind of, GLUT4 is kind of a pathway.
Okay, so thank you, doctor, for clarification of all these medical informations.
It's too deep, Swamiji, but it's good. Good to know.
Yes. So thank you very much. So should we stop here? Okay, so tomorrow is Saturday or what
Friday.
is it?
Friday.
Oh, tomorrow is Friday.
Yoga training from Rameshji.
Oh, Friday is Rameshji. Okay.
And
So
then
thank
Saturday, 9 o'clock, again back to usual.
Okay. Tomorrow it